Hi, good morning, Elvis. My name is Mihiraa. Let's start the warm-up session. What is your career goal after reaching your dream destination?
Right now, I do not have any clear management goals. I am very interested in learning about management and leadership and would be interested in any committees that I could participate in and learn. I have lots of ideas and would love to be in a brainstorming group, and I am very interested in the management dynamics of the organization. I feel that I need to join leadership groups to learn and meet new people.
What are the qualities that a nurse should possess?
Of course, a nurse should possess a variety of qualities. First of all, she should possess excellent communication skills, which help them not only to gather clinical data, but also to maintain an effective relationship with other team members. Secondly, problem-solving and critical thinking skills are essential for nurses to deal with emergencies and difficult situations. Other qualities such as punctuality, dedication, honesty, and competency are also pivotal for nurses.
What are the pieces of advice for the upcoming nurses?
As a nurse, I can give a bunch of advice to upcoming nurses. Firstly, I advise them to love their profession. If anyone loves their profession, they can carry out their responsibilities in an efficient manner without complaints. Apart from that, I advise them to be dedicated to their profession and maintain professional standards. These are essential because a nurse should abide by nursing ethics on any grounds. These are a few pieces of advice that I would like to give to future nurses.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
Your preparation time is over. You can now start your role play.
Thank you, Mihiraa, for allowing me to conduct your assessment. First, to help me understand better, could you tell me more about your symptoms?
Sure. The itching started about 2 weeks ago. It's very intense, especially at night. I feel it mostly between my fingers, on my wrists, and around my waist. My husband has also started scratching his arms, but my 2 children seem fine so far.
Thank you for explaining that so clearly, Mihiraa. That really helps. From your symptoms and the examination, I can confirm that this is scabies. Scabies is caused by very tiny mites that you cannot see with your eyes. These mites burrow under the top layer of your skin to live and lay eggs. It spreads from person to person through direct, prolonged skin-to-skin contact. Please know this has nothing to do with poor hygiene. Anyone can get scabies.
Oh, I was so worried people would think I'm dirty. That's a relief to hear. But what do I do to get rid of it?
It is completely understandable to feel that way, Mihiraa, but please know that this has nothing to do with hygiene. It is simply a common skin condition that can affect anyone. To help your skin heal, the most important step is keeping the area clean and dry before starting your treatment. You will need to apply a permethrin cream or lotion thoroughly from your neck all the way down to your toes, ensuring every fold of skin is covered. This medication needs to stay on your body for at least 8 to 14 hours, typically overnight, before you wash it off. Because the life cycle of the mites can be persistent, you must repeat this entire application exactly 1 week later to ensure the treatment is fully effective. As you go through this process, do not be alarmed if the itching continues even after the mites are gone. It is very common for the skin to remain itchy for 2 to 4 weeks as it recovers. To stay comfortable during this time, you can use over-the-counter antihistamines or apply soothing calamine lotion to the irritated areas. Rest assured that by following these steps and giving your body time to react to the treatment, you will be back to your usual self soon.
That sounds doable. But what about my husband and children? Do they need the cream even if they don't have itching yet?
That is a very important question, Mihiraa, and you are absolutely right to ask about them. Because this condition is highly contagious through close physical contact, it is vital that your husband and children apply the treatment cream at the same time as you. Even if they are not showing any symptoms or feeling itchy yet, they could still be in the early stages of an infestation. Treating everyone simultaneously is the most effective way to prevent the infection from being passed back and forth within your home, ensuring that once it is gone, it stays gone for good. Beyond the cream, you will need to focus on decontaminating your living space to prevent reinfection. Please wash all bedding, towels, and clothing used by your family in the last 3 days using very hot water, and dry them on the highest heat setting possible. For items that are not washable, such as certain pillows or delicate toys, you can simply seal them in a plastic bag for at least 72 hours. This is effective because the mites cannot survive without human contact for more than 3 days. Mihiraa, do you have any other concerns?
I'm still feeling a bit embarrassed about telling people. And how will I know if something is going wrong?
It is completely understandable to feel a bit uneasy about this, Mihiraa, but please remember that there is no reason to feel embarrassed. This is a very common condition that can affect anyone regardless of how clean they are, and it is simply a medical hurdle that we are going to clear together. You are taking all the right steps to handle it responsibly, and once the treatment is finished, it will be behind you. Most people find that following the cream regimen and cleaning their linens is all they need to do to get back to normal, so try not to let this weigh too heavily on your mind. While the treatment is very effective, it is important to keep an eye on your skin as it heals to ensure everything is progressing as it should. You should reach out for further medical help if you notice any signs that a secondary skin infection might be developing. Look out for things like yellow crusting on the sores, the presence of pus, or if an area starts to show increasing redness, warmth, and pain. These signs usually mean that bacteria have entered the skin through scratching, and we want to catch that early. Are there any specific symptoms you are worried about, or is there anything else I can clarify for you?
Thank you, Elvis. That makes me feel so much better.
You are most welcome. Let me summarize everything for you, Mihiraa. You have scabies caused by tiny mites, not because of poor hygiene. You will apply permethrin cream from neck to toes for 8 to 14 hours, wash it off, and repeat exactly 1 week later. Itching may last 2 to 4 weeks after treatment. Use antihistamines or calamine lotion for itch relief. All household members must be treated at the same time. Wash all bedding, towels, and clothes in hot water and dry on high heat. Seal non-washable items in a bag for 72 hours. Do not feel embarrassed. This is common. Seek help if you see yellow crusting, pus, or increasing redness and pain. Do you have any final questions before you leave? No, that's very clear. Thank you so much. You are very welcome, Mihiraa. Take care, and we are here if you need us.